Jai Hind students, today we are going to study new chapter infrastructure. Infrastructure provides supporting services in the main areas of industrial and agricultural production, domestic and foreign trade and commerce. These services include roads, railways, ports, airports, dams, power stations, oil and gas pipelines, telecommunication facilities, the country's educational system, including clear drinking water facilities and a monetary system, including banks, insurance, and other financial institutions. So, as infrastructure, we can say that by seeing the economy economic infrastructure, a country is developed or not is being analyzed. So it is mainly important to study the infrastructure of an economy. Role of infrastructure. Higher economic growth rate. Higher rate of economic growth can be achieved through infrastructure. Higher the development of infrastructure, higher will be the rate of economic growth. So as I said that a country's economic growth is analyzed by its infrastructure. So higher the infrastructural growth, the higher will be the economic development. It is analyzed like that. So next, second point, increase in productivity. Infrastructure helps in raising productivity. It leads to low cost of production. So it increases what productivity by infrastructure or new technologies, or we can say that new transportation facilities and all, it will increase the productive capacity. So that is the second point. Third point, increase in the efficiency of labor. It widely mobilizes manpower through means of transport. As a result, the efficiency of labor increases. So by means of transport, we say that the economic growth may be attained, and as a result the labor can be can be mobilized, that is, he can be acquired more knowledge about by traveling from one place to another, by developing his skills and all, and by getting trainings from different areas. So thus in such a way, increase in efficiency of labor can be attained. So next is extension of market. It helps in widening the extent of market. So as I told you, by transportation and all, we can extend the market situation. So next is optimum use of resources. Infrastructure helps in efficient utilization of a country's resources. In this way, it leads to optimum use of resources. So optimum use of resources means what? We can acquire by traveling, or by knowing more things by traveling, and we can collect different things from different areas, and we can use the resources for different purposes. Thus we can optimize the resources, and optimum use of resources can be made for the development of a economy. Infrastructure promotes development. So there is a direct relationship between development and infrastructure. So infrastructure contributes to economic development of a country, both by increasing the productivity of the factors of production and improving the quality of life. Second point is infrastructure develops agriculture. Modern agriculture largely depends on infrastructure growth for speedy and large-scale transport of agricultural inputs like seeds, pesticides, fertilizers, etc. It uses facilities of modern roads, railways, and shipping facilities for marketing its products. As a result, agriculture can be modernized and expanded. So third is infrastructure facilities, smooth functioning of economy. Infrastructure is the support system on which efficient working of modern economy depends. Infrastructure enhances productivity in three sectors of the economy. primary sector and secondary sector and a service sector or tertiary sector. So primary sector we can say that by providing services of irrigation, finance, transport, electricity, etc. And in secondary sector increases because of strong support of energy sources such as coal, electricity, petroleum, wind energy, etc. And service sector we can say that depends on infrastructure development, modern upgraded means of transport, communication, banking, insurance, etc. facilitates developing the service sector fast by enhancing its productivity. So that is third point. So next fourth point is infrastructure enhances quality of life. Infrastructure contributes towards improving the quality of life of citizens of the country, and improvements in water supply and sanitation have a large impact by reducing morbidity. So morbidity means what? Falling ill. So from major waterborne diseases and reducing the severity of a disease when it occurs. So fifth point, infrastructure expands market size. Creating new markets and expanding the existing ones is very important for increasing production. Strong support of transport, communication, finance, banking, advertisement, etc. help in expanding the size of market. So next is infrastructure promotes capital formation and investment. Sixth point, so strong support system like education, energy, transport, communication, etc. help in raising productivity and thus production. As the output increases, generation of income also increases. It would cost more saving and more capital formation, implying more investments. An increase in domestic investment would promote the large scale production and wider markets, which may attract foreign investors also to invest in the country. So next seventh one is infrastructure facilities outsourcing. So India is emerging as a global destination for BOPs, call centers, study centers, medical transcriptions due to developed social infrastructure, especially revolutionary growth of IT sector. So by outsourcing the job, we can develop our economy, and this encourages economic growth by promoting modernization, globalization, and changed outlook towards new areas of development. So eighth point is infrastructure promotes interdependence and linkages in production. Economic infrastructure and social infrastructure work in coordination, and these together promotes the benefits of being interdependent and cause linkages in producing goods and services. And we can say that without each other, that is help of each other, economic and the social infrastructure, an economy cannot be developed, and development in one sector automatically brings growth in the other, and growth becomes dynamic and continuous, resulting in overall development of the economy. So we can divide the infrastructure into two, that is economic infrastructure and social infrastructure. So in economic infrastructure consists of energy, transport, communication, and social infrastructure consists of education, health, etc. So as per your syllabus, only health is there for your studies. So health is wealth, is known by all. This means staying healthy is important. A healthy person can generate any amount of wealth. Health means a state of complete physical, mental, and social soundness. Health is not only absence of disease but also the ability to release one's potential. So economists judge the health condition of the people of a country by looking at the following indicators. So by looking the following indicators, economists consider that whether a country is developed or underdeveloped. So infant mortality. So the children who are not reaching the age of 1 and they are dying, so that is known as what? Infant mortality. So maternal mortality means what? within the pregnancy period a child is dying, so that is known as what, in maternal mortality. Life expectancy means how till how many years a person can live, so that is known as what, life expectancy. Next is nutritional levels. So nutrition levels of the people who are staying in a country, so that is also being judged. Next is incidence of diseases, that is occurrence of diseases, how many times so the diseases have been spread in a country. So next is health infrastructure. Health infrastructure means what, it may be hospitals beds, hospital beds, and the clinics etc will come under health infrastructure. So this topic is very important because we are facing very severe health issues now due to corona and all. So this portion definitely been asked, giving you certain examples of health study or the data regarding corona etc, and you have to view your own ideas. So that is the health condition I had told you, very important. Next is main characteristics features of health. Health infrastructure of India consists of three tiers: primary, secondary and tertiary. Primary health care, it includes education relating prevailing health problems, methods of identifying, preventing and controlling them are also included in it. So how the disease have been occurring and how we are controlling it by spreading it, so that is known as what, a primary health care system. So primary health care includes food supply, proper nutrition, water supply, sanitation, maternal and child health care, immunization against major infectious diseases. To achieve this objective, primary health care and hospitals have been set up in villages and small towns. They are known as primary health care centers or community health centers and sub centers. So these are primary health care system which they care of the following food supply. The points have been discussed above. Next is secondary health care. Hospitals which have better facility to healthcare are called as secondary healthcare. It includes surgery, X-ray, electrocardiogram, ECG. These are mostly set up in district headquarters and in big towns. So this is secondary healthcare. So next is tertiary healthcare. The complicated health problems which are not managed by the primary and secondary healthcare fall under the tertiary sector. Tertiary healthcare includes advanced level equipments and medicines. All these hospitals are located in big cities. The tertiary sector also includes many premier institutes. They impart quality medical education, conduct research, and provide specialized healthcare. Some of them are All India Institute of Medical Science AIMS, New Delhi, and second Postgraduate Institute PGI Chandigarh, and National Institute of Mental Health and Neurosciences NIMS, and we can it is at Bangalore, and All India Institute of Hygiene and Public Health, Kolkata. Present government has introduced an organization, that is Ayushman Bharat, as a free medical facility for poor community. So now in Ayushman Bharat we can say that for the prevention of corona they had introduced a app known as what, Arogya Setu app. So that is known as what, the people who are affected in corona, so they have been identified, and we are getting the news regarding that, and we can identify whether the nearby areas that we are staying are having this disease spread, and we can protect ourselves from these diseases. So a important question may be asked from this area health, so it's important. Health infrastructure consists of hospitals, doctors, nurses, and paramedical professionals, beds, medical equipments, and adequate medicines. So these consist of health infrastructure. So public health infrastructure in India. So the government is known as public. So your public health, government functioning under public health is known as public health infrastructure, and the government has the constitutional obligation to guide and regulate all health related issues such as medical education, adulteration of food, drugs and poison, medical profession, vital statistics, mental deficiency and lunacy, and improvement in health infrastructure and availability of new drugs and vaccines enabled us to eradicate diseases like smallpox, polio, and leprosy are close to eradication. So we have, by improving the health education and health what researchers and all, our main diseases like polio and the smallpox and all have already been eradicated from our economy. Next is private health infrastructure. So private sector, that in recent times private sector has been playing a dominant role in medical education and training, medical technology and diagnostics, manufacture and sale of pharmaceuticals, hospitals construction and provision of medical services. So now we can say that the private sector has been improving than the public sector by giving more and more education, and medical technological aspects have been introduced from abroad. So like the private sector has been developing now, and more than 70% of hospitals in India are run by private sector. They control nearly two-fifths of the beds available in hospitals. Nearly 60% of dispensaries are run by same private sector. This sector provides healthcare for 80% of outpatients and 46% of inpatients. So in 2001 2002 there were more than 13 lakh medical enterprises employing 22 lakh people. More than 80% of them are single person owned and operated by one person, occasionally employing a hired worker. So it was what we can say that the 13 lakh medical enterprises were employing, means doctors were employing, new small hospitals have been generated, and they are employing a single person, that is it may be attender or it may be somebody for help. So they are employing the persons like that, or the single person or the doctor even alone may be operating a small clinic. So that is one of the important thing that have to be noted. And the private sector in India has grown independently without any major regulations. Some private sector practitioners are not even registered as doctors and are gone as quacks. So they are some we can, so in this situation, as many private sector hospitals have been developed, and we are not judging whether they have licenses or not, and whether they have a practitioner in any hospitals and all, we are not judging it. So like that, some unregistered doctors have been quacked by or caught by the the police and all. So that is one of the most dangerous thing. Next, since the 1990s, owing to liberalization measures, many non-resident Indians and industrial pharmaceutical companies have set up state of the art super specialty hospital to attract India's rich and medical tourists. So we are making certain what contribution to the pharmaceuticals, and big industrial non-residents have been coming to our country and setting up new hospitals for the attraction of the medical tourists to come in our country and give the what give our country a fame. So like that also some action has been taken. So this is all about private sector health infrastructure. So I had told you as medical tourism prospects for India. So what and all medical tourism that are attracting people. So a fast growing area in the health sector is medical tourism. Medical tourism for medical treatment. Formerly Indians were going abroad for treatment. Now the reverse happening. Foreigners are coming to India for treatment for the following reasons. So reasons are India has highly advanced medical infrastructure for treatment and availability of highly qualified specialists and a well developed pharmaceutical industries, and the cost of medicines in India is one of the lowest in the world, and we can say expenditure on medical treatment is very low compared to the expenditure in developed countries. So we can just see the example now what's happening due to corona. We can still see that the medicines that we are taking, those who are staying abroad, they are taking the medicines with high cost, but the same medicine which has been treated in India has been valued very less. That is, the people who are staying abroad are urgently coming to our nation because without any money they can't survive in their the foreign country. So they are coming to their hometown. So that is one of the important thing. So next is Indian system of medicine, ISM. India is famous for her own indigenous systems of medicine. ISM comprises 6 systems Ayush. An important advantages of ISM is that it is less expensive. Also, side effects of treatment are less compared to allopathy. Ayurvedic treatment is emerging as a major tourist attraction and a foreign exchange earners. So we can say that Ayurveda, what is Ayush? We can just see it is Ayurveda, Yoga, Unani, Siddha, neuropathy and homeopathy. So these together is formed as Ayush. So this medical field is most attracted for the foreigners now than the allopathy. So next is indicators or status of health services in India. The health status of a country can be assessed through indicators such as infant mortality and maternal mortality rates, life expectancy and nutritious level, along with the incidence of communicable and non-communicable diseases. Some of the health indicators and India's position are given below. So these I had told you, these are the most important indicators for assessing the development strategy of a country. First thing is decline in death rate. There is remarkable decline in death rate from 27.4% per thousand in 1950-51 to 7% per thousand in 2015-16. So this is the death rate. So at first it was 27.4% dying. Now it has been reduced to only 7% dying. 7 per thousand heads. So per thousand people the relation is like this. And next is decline in infant mortality rate. So what is infant mortality rate? The infant mortality rate is the number of infant deaths for every 1,000 live births. So that is with 1,000 live births or 1,000 people, it has been all the indicators has been assessed. So what is the condition of next infant mortality? Decline in infant mortality rate infant mortality rate has reduced from 146 infants per thousand in 1950-51 to 37 infants per thousand in 2015-16. So that is the rate that is prevailing now. So what was 146 was previous, now it has been reduced to 34. It may be what may be the reasons? Because of good medical care and good educational facilities and better sanitation. So these may be the reasons for this decline. Next is rise in life expectancy. Life expectancy has increased from 32.5 years in 1950-51 to 66.9 years in 2015 for males, and life expectancy has increased to from 31.7 years in 1950-51 to 69.9 years in 2015 for females. So this is the ratio. So this may also be the same reasons because of better education, healthcare, etc. So next is control of communicable diseases. So India has given a high priority to control the following communicable diseases like smallpox, malaria, leprosy, tuberculosis, AIDS, etc. So this has been controlled in India. So next is one of the important aspect, that is global burden of diseases. So India has about 20% of global burden of diseases, GBD. GBD refers to the number of people dying prematurely due to a disease, and number of years spent by them in a state of disability. More than half of GBD is due to communicable and waterborne diseases such as tuberculosis, diarrhea, and malaria. Malnutrition, inadequate supply of medicines, and AIDS are looming large over the economy. So this is one of the most important factor that is still, we can say, that prevailing in India due to the waterborne disease, due to lack of sanitation and better healthcare facilities in rural areas, and due to less awareness of the diseases. These things have been spreading. So GBD is an important concept that may be asked. So you have to study that. So what is GBD? GBD refers to the number of people dying prematurely due to a disease, and number of years spent by them in the state of this disability. So how many people are dying with a state of disease which can't be curable. So it is what stagnant with them, and at last this disability leads to the death. So this is the global burden of diseases. So this is, you can say that India is having 20% of the global burden diseases. So next is National Rural Health Mission, NRHM. So a 7-year National Rural Health Mission had been launched to address infirmities and problems across rural primary health care. Converging the public health approach with primary care has been one of the primary objective of the mission. Another objective of genuinely empower and support Panchayat Raj institutions to manage, administer, and to accountable for health services at community levels. So all by Panchayat Raj system, that Panchayat Raj and Panchayats and all, the news can be spread. So that is the importance that they are seeing here. And the supervision of health sub-centers by Gram Panchayat, where improve attendance of staff, motivate appropriate quality of care, and provide constant feedback on the patient satisfaction. So NRHM was to also converge the management of health delivery across all systems of medicines at primary health levels. So other noteworthy aspects are NRHM is expected to address the gaps in provisions of effective healthcare to rural population, with special focus on 18 states which have weak public health indicators and weak infrastructure. The mission is a shift away from a vertical health and a family welfare program to a new architecture of all inclusive health development, in which societies under different programs were to be merged and sources be pooled at district level. So this is the most important aspect that we are seeing in this. Third point, it aims at effective integration of health concerns with the determinants of health like safe drinking water, sanitation, and nutrition through integrated district plans for health. There is a provision for flexible funds so that the states may utilize them in the areas they feel are important. So the mission was to provide the for appointment of ASHA workers, that is accredited social health activists, in each village and strengthen public health infrastructure, including outreach through mobile clinics. It emphasizes involvement of non-profit sector, especially in urban served areas. It also worked at a flexibility at the local level of providing for untied funds. So it may be helping for fund provisions. So the ASHA workers and all are coming to the rural areas and finding the spread of the diseases, and they are giving the curable medicines. So next is the mission in its supplementary strategy was to aim at fostering public-private partnerships, regulating the private sector to improve equity and reduce out-of-pocket expenses, introducing effective risk pooling mechanism and social health insurance, and taking advantage of local health traditions. So these are the some of the points that have to be noted. So it is mainly aiming at the participation of both the public and the private participation to reduce the expenses from the rural sector. This mission has been introduced, and many activists have been introduced for this the spread of diseases and all. So to for removing that diseases, that ASHA workers and all are going to the houses and finding the disease spread, and they are giving medicines for that. Next is rural urban divide and poor rich divide. Though 70% of India's population live in rural areas, one fifth of its hospitals are located in rural areas. Rural India has only about half the number of dispensaries. Out of about 6.3 lakh beds in government hospitals, roughly 30% are available in rural areas. Thus, people living in rural areas do not have sufficient medical infrastructure. This has led to difference in health status of people. As far as hospitals are concerned, there are only 0.336 hospitals for every 1 lakh people in rural areas, while urban areas have 3.6 hospitals for the same number of people. The primary health care centers located in rural areas do not even offer x-ray or blood testing facilities, which for city dwellers constitutes basic health cares. And states like Bihar, Madhya Pradesh, Rajasthan, and Uttar Pradesh are relatively lagging behind in the healthcare facilities. So we can find that only city dwellers, the people who are living in, that is the clinic who are started in the cities, are having the x-ray facilities and all, but the primary health care centers where the most needy people, that is rural people, are going and in search of this facility, but they are not getting it. So that is this point. So villages have no access to any specialized medical care like pediatrics, gynecology, anesthesia, and obstetrics. And even though 380 recognized medical colleges produce about 44,000 medical graduates every year, the shortage of doctors in rural areas persists. While one fifth of these doctors graduates leave the country for better monetary prospects, and they leave the country and go abroad for the studies or work. So many others opt the private hospitals, and which are mostly located in urban areas. So rural area they don't get any benefits. So the poorest 20% of Indians live in both urban and rural areas, spend 12% of their income on healthcare, while the rich spend only 2%. That is, poorest who are living in rural areas, they have to pay higher because they are poor and they have to travel abroad long distance for the medical facilities. So as a result they have to pay 20% of their Indian, that's livelihood, that is 12% have to be spent of their health care for the health care. So many poor people have to sell their land or even pledge their children to afford the treatment, since government run hospitals do not provide sufficient facilities. So the poor are driven to private hospitals, which make them indebted forever, else they opt to die. So this is the situation of rural. Next is women's health. Women's health. Women constitute about half of the total population in India. They suffer many disadvantages as compared to men in areas of education, participation in economic activities, and healthcare. The deterioration in the child sex ratio in the country from 927 in 2001 to 914 in 2011 points to growing incidence of female foeticide. Close of 3 lakh girls aged below 15 years are not only married but have already born children at least once. So this is the deterioration condition of children, women. So more than 50% of the married women in the age group of 15 to 49 years have anemia and nutritional anemia causing by iron deficiency, and which has contributed to 19% of maternal deaths. Abortions are also a major cause of maternal morbidity and mortality in India. Health is a vital public good and a basic human rights. All citizens can get better health facilities if public health and services are decentralized. It is therefore critical to create awareness on health and hygiene and provide efficient system. So the role of telecom and IT sectors cannot be neglected in this process. The effectiveness of healthcare programs also rests in primary health care. The ultimate goal should be to help people move towards a better quality of life. In order to provide basic health care to all, accessibility and affordability need to be integrated in our basic health infrastructure. So they have to be coordinated and run. Next is challenges or deficiency in health infrastructure. Unequal distribution of healthcare. Distribution of healthcare facilities is very inequitable across different parts of the country. 20% of total hospitals and 50% of total dispensaries are located in rural areas, despite the facts that 70% of India's population lives in rural areas. So next is second is spread of communicable diseases. There is urgent requirement to identify, prevent, and make people aware of social communicable diseases which are posing a serious threat to the society. These diseases are AIDS, HIV, and SARS. So third is privatization of healthcare. So private sector has grown by leaps and bounds in providing healthcare facilities. Private sector plays a major role in medical education and training, medical technology, manufacture, and sale of pharmaceuticals, etc. But the healthcare provided by the private sector is very expensive, which is beyond the reach of major part of Indian population. So that is one of the reason. So next is fourth one, improper sanitation. facilities. Level of sanitation is very poor in India. We in India are not able to maintain the required standard of keeping our surroundings clean and making people aware of the benefits of clean surroundings. So it is observed that about 30% of the houses in urban areas do not have toilet facilities, and dwellers live pathetic populated atmosphere. Rural population does not have even 20% of minimum sanitary facilities. Next, fifth point is poor maintenance of healthcare centers. Maintenance of public healthcare centers, hospitals, dispensaries is very poor. No efforts are spared to maintain the healthcare centers. The reason for this lack of funds is lack of funds. Private sector does not have face this problem, but this sector passes the cost of maintenance to people to who avail their services by charging the big amount of fees. So private sector will charge big amount of fees from the public. So that is the one of the challenge. Next is lack of coordination. There is huge shortage of health personnel uh, corresponding to their requirement to provide healthcare facilities. Health personnel are inadequate to meet the growing need of medical assistance, especially in rural areas. Lack of manpower forces people to either depend on quacks or on private doctors who charge very high, which may be not affordable to many peoples. So next is measures to solve deficiency in health infrastructure. The first point is decentralization of public health care services. So next, if public health services are decentralized, all citizens can get better health facilities. Health services should be properly located in different areas according to the requirements. Next is creating awareness. It is critical to create awareness on health and hygiene, proper sanitation facility, vaccination, communicable diseases, availability of medical assistance, etc. This awareness can be created through newspapers, radio, television, etc. So the role of telecommunication and IT sectors cannot be neglected to provide the efficient systems. Third is the effectiveness of a primary health care system. Effectiveness of healthcare programs also rests on primary health care. The ultimate goal should be to help people move towards a better quality of life. Next is reduction in urban rural divide. There is a sharp divide between urban and rural care in India. If we continue to ignore this deepening divide, we run the risk of stability, the stabilizing of a socio-economic fabric of our country. Therefore, proper management of healthcare facility should be done so that this gap can be reduced. So next is easy access to healthcare facilities. In order to provide a basic healthcare facilities to all, accessibility and affordability need to be integrated and coordinated in our basic health infrastructure. Next is increase in investment. There is a lack of investment, especially in public health. Therefore, investment should be increased so that more healthcare institutions can be opened. New innovations and research can be carried on to develop in treatment to some dangerous diseases, and provides and private sector and foreign sector can also be given more concessions and incentives so that investments can increase at all levels. So these points are to be noted for the development of the health sector. So this is an important question that is being expected from this board for the for your coming board exams. So if you have any doubts, please ask me. As you know, now the situation is of the corona and all, so mostly health sector facing difficulties, etc., may be asked. Hope you understood everything. If you have any doubt, please ask me. Thank you.